Hello viewers, and welcome to your favorite weekend current affairs program on Star TV, captioned The Hard Truth. On this program, we invite technocrats and the powers that be to come and explain to us very hard information we need from them. And today, I have in the house a professor who is a woman, and I'll be introducing her just after this break. My name is Atiplaja Eric Salikem. Welcome back, viewers, to the Hard Truth, a current affair program on Star TV every weekend, which seeks to educate you on the needed topics that we have to take a look at to help Mother Ghana grow. Today, as I said earlier, I have in the house a professor who is going to help us understand the nitty-gritties of COVID-19, how it came about, what it is at all. Did someone generate it? All the questions you will think about. We'll be asking all the funny questions on the Hard Truths this weekend. And before then, let me use my sanitizer before I welcome my professor onto the show, because that is what we need to be doing at this particular time. He said we have to sanitize our hand. So as I'm doing it, I think you also do same. I have to do that first before I finally say welcome to my professor onto the show. Okay, so Professor Margaret Kweku, you are welcome to the Hard Truth Show on Star TV.
Thank you very much.
You are brighten in your apparel this afternoon.
Thank you.
All right, and we have you here. It's a privilege to have you here, and today you are going to teach us a lot on COVID-19. But before then, you are also the parliamentary candidate for NDC in the Hoho municipality. But you have chosen to lay that aside and pursue the course of teaching the people about COVID-19 and how to stop the spread. Why did you choose that path?
I have to choose that path because it is human beings who are going to vote for us, and they must be in good health. And by my profession, I'm a medical doctor and I'm an epidemiologist. I deal with diseases, where they come from, who is affected, how they are affected, what is the outcome, and how is their economic impact. And so with this deadly disease outbreak, I cannot continue with politics whilst the people are suffering. So I thought the best thing to do is to lay down the politics and make sure that my people are safe before we can continue.
Well, that is something we all need to emulate as growing adults, to lay down a political ambition to take up this particular mantle is something that we all have to emulate. Young adults and then ladies are watching. In this part of our world, it is always somehow not common to see women climb to the peak of the educational ladder. But she is a professor. You have something to learn from her. I have something to learn from her. I'll be questioning her on that particular role. Madam, you are a professor. Looking at this part of our world, most women, or what we heard growing up, is the kitchen is for the women, and so they are not supposed to go to school too much. I want you to be a source of motivation to a lady or a woman out there where you've got into. What advice do you have for women before we proceed?
I think we as human beings created by God, be it male or female, we can do everything. I don't think we need to designate certain roles only for women and some for men. So when I was growing up, even when I was in school, I used to hear my colleagues saying that as for me, the woman's office is the kitchen, so I won't bother myself. But I felt that no, we need to go up there I wouldn't like to be a woman who will drop out and then the man goes high. Later on, he gets another woman who has climbed up. We must all get there before we meet. So that was my principle. And I made sure I stick to it.
Not bad. This part of the world, mostly the women are discouraged by her or her own peers, as you rightly said. Even parents are also part. They will say, we want the boy to go to school and then let the girl be helping in the house. What advice do you have for such parents?
I think my mother set an example. My mother was the one who sent me to secondary school. When I passed common entrance in Form 1, my father was not prepared. He said I was too young. Form 2, I passed common entrance. He said, oh, he just gave me money to try. And so he wasn't interested.
And you were surprised you were able to make it.
And my mother sent me to secondary school. And luckily enough, when I got there, I was on government scholarship.
Oh. Parents, I think we need to encourage our female kids or our young adults who are women to climb the educational ladder to the peak, as Prof is demonstrating his typical example to us. Okay, Prof, before we veer straight into COVID-19 and the issues arising from that angle, I want you to share with us a little bit. Where did you start your education from, and where have you got into now?
I started my education from Hokwe here, from class 1 to 6.
Hokwe?
Yes, at St. Teresa's demonstration school.
Oh, really?
Yes.
Wow.
And I was the girls' prefect.
You started taking up leadership roles from that young age?
Yes, from class 1, I was always a cupboard girl.
Was there any encouragement?
No, the teachers appointed me.
Why? What were their reasons?
Well, the teachers can explain. Maybe they saw something in me.
Wow, okay. Well, that's interesting. So from there, primary school at St. Teresa's,
yes.
Where did you find yourself?
I moved on to Ola Secondary School.
Okay.
Yes, but somewhere along the line, I moved to Nkonya Secondary School.
Okay.
Where I completed my O levels, and I was the girls' prefect over there too.
Oh, well, you've just been bullying the boys, taking up prefectship or leadership roles in school days.
I was not bullying them. I was proving my strength.
Oh, okay.
Yes.
You can also do what the men have been doing,
yes.
Isn't it?
Yes.
Wow, it's something we can just emulate from you. Okay, so in which year are we talking about your SHS days?
Oh, this was in the 80s.
Oh, okay.
Yes,
okay.
In the 80s.
Someone like KLM, my cameraman,
wasn't born.
No, he wasn't born by then.
Yes.
Let me think about Duncan. Duncan would have been crawling, and then maybe Edem would have been in the mother's womb. Most of them were not born.
Yes.
Probably only me.
Yes.
All right. Okay. So let's move on from the secondary sector. Where did you move to?
From the secondary sector, I moved to the medical school in the Soviet Union.
Okay.
And I did my medical course over there. And I came back to Ghana in 1991.
I was 1 year. But then, just 1 year.
Yes.
But still, other than most of my colleagues.
That's it.
All right, so you went to the Soviet Union to study
medicine,
and then you came back to help Mother Ghana. Yeah. All right, where did you specify your area of specification in terms of medicine?
Well, I did general medicine.
Okay.
So I came back and I was a general practitioner.
Okay.
It was later on when I was made the district director of health services at Hokwe here. I realized that I need further education to be able to handle that aspect. So I went to Legon to do masters in public health.
Oh, okay.
Yes. Then later on, I continued to do MPhil in public health.
Wow. Wow.
After which I continued to the London School of hygiene and tropical medicine to do my PhD.
Wow, more than qualified. I think I'll encourage my girl child to follow the footsteps of Professor Margaret Kweku. That's something I think most parents will have to encourage their their girl children or child to also be able to start something of that sort, because most of the time we say to them that they are supposed to be in the kitchen, they are not supposed to further the education. And what you have demonstrated right now, you are more than qualified. That's why the NDC made you their candidate for probably parliamentary candidates, isn't it?
I don't think that is the reason.
What was the reason you think NDC appointed you as they voted overwhelmingly for you to be their PC?
Well, I was the municipal chief executive somewhere along the line. I served for 4 years before moving to the university. And then when I was there, they saw my performance. And they realized that, yes, I can actually do the work even better than the men.
You're able to break the legs of 6 other men, am I right? Who were with you in the race, and you're able to break their legs and come out victoriously. Am I right?
You are right.
All right, well, quickly, this is what we are experiencing in Ghana, coronavirus. And we were just there. It started from China, and then it moved across the world, and then it is with us now. What brought about all this coronavirus thing? Some people think that the Chinese themselves decided to go into their lockout and manufactured something. Some also think it's a spiritual curse from God. What's your idea about how coronavirus actually came about?
What I think as an epidemiologist is the cause of all these things is that, you know, there are other diseases. Even from 2002, a disease was discovered called SARS. That's severe acute respiratory syndrome. These diseases occur. It's also a viral infection. So 2012 also another form occurred. And this 2019, they thought it was the same form. But what we need to know is that these organisms, as they are with the environment, they try to change their form to be able to survive. When you are trying to attack them in one way, they can change their form, and then they come back in a different form.
Wow.
So this time round, what has come is not the usual SARS that we have been experiencing. Initially, they thought it was that SARS, but now they've realized that this one is more deadly, more invasive, it is attacking more people, and somewhere in January, WHO declared that this is going to be a pandemic. When we talk of pandemic, it simply means that it's going to affect the whole world. Whilst when we talk of endemic, it means it is in a particular location. But this one is affecting the whole world.
All right, Prof. Some section of the public also thinks that it is because some people in China still consume live animals like rats, and they just chew them like that, and that is the reason we have this kind of coronavirus in China. Could that be true? Is there any truth in that?
You can't just speculate. Right now we can't tell whether it evolved from that. It could be that this virus started in animals, but how it got to human beings, we don't know. I think we need to investigate further and stop speculating.
Okay, in your field, the investigation that you are talking about, have we started here in Ghana? Have we started doing anything to find out actually what the cost of that virus is?
In actual fact, in Ghana, the disease did not start from here.
Okay.
We started getting imported cases. That is, people who travel to affected areas come with the disease. And now we are getting community infection. When we talk of imported cases, we are referring to person-to-person transmission.
Okay.
One person to the other. The person comes from outside, brings it, and those who come into contact with the person, they also get it. That's person to person. But at a point, you can't actually trace where you got it from. Then we call it community transmission or horizontal transmission. So now in Ghana, we started with person to person, but now where we are, it is now affecting everybody. We can't trace it to somebody who came from an affected area outside. So now it is now we face. So we are now facing an epidemic. We can't go now start saying that we want to study which animals carry the infection and how did we get it. We need to battle with the pandemic and the epidemic in Ghana first before we even start looking at that. I think in China they can be doing that to inform the world.
They can start searching for the source. Okay, even as they don't have the vaccine now, will they be able to get the source actually?
Getting a vaccine is different from the source of the infection.
Okay.
A vaccine is to protect people from getting infected.
Not to cure.
Not to cure. Vaccine does not cure, but protects you against the infection.
Prof is revealing a lot of secrets to us today. He's teaching us a lot, and I'm happy you're also watching and you'll be learning a lot from it. I'll be taking your messages as well via WhatsApp and text messages. Let's go for a quick commercial break. We'll be back to continue the discussion with Professor Margaret Kweku, who is a professor, and she has the technical know-how of actually what is happening. We, the journalists, the lawyers, other people, they just speak the minds of World Health Organization, Ghana Health Service. And she is a master on the field. We'll be right back to have more dialogue with Professor Margaret Kweku. Welcome back to the Hard Truth on Star TV, your weekend most cherished and watched current affair program. I still have in the house Professor Margaret Kweku, who is helping us to understand one or two things surrounding COVID-19. So we started talking about a lot of things. There are a lot of things I've also heard about her, and he'll be revealing that since this program is the Hard Truth, she has to reveal certain truths to us. So stay back and enjoy the rest of the program. Prof, we're back to educate our viewers as well. I've heard that you are a member of the COVID-19 NDC technical team, made up of some 11 members. Is that so? What is that team? What is the reason for that team?
Yes, that team was set up by our flag bearer, the former President John Dramani Mahama.
Okay.
He set up that team not as a parallel team to government, but to provide support to government.
Okay.
So we as a technical team are not representing NDC as a party, because people are brought from all over with their technical background.
Okay.
And the work we have to do is to look at what can we do to contribute to this outbreak that we have.
Okay.
Yes.
All right. So this 11-member team that was set up by the flag bearer, what is their mandate and what have they been doing as we speak?
So far, we have met on 2 occasions, assigned roles. Everybody, depending on your background, you go in and then look at what we can do to support government.
Okay.
We need to look at what government is doing. We need to advise and then support. So when government has a meeting, some of the members also attend and let them know exactly what we are doing.
Okay.
Where they are not actually pushing hard to do much, we try to come back and see what we can do to help. For instance, we met, looking at our background, they said, let us look at who can do research, who can do this, because we need the facts to support everything that we are doing.
Okay.
So I, for instance, am one of those who can go into research and advise.
Oh, okay. All right. So that is your specific field that you have taken. So
Yeah.
far, what have you done to augment the efforts of the group in your capacity?
In my capacity as a member, I have done some investigations with written reports. I will even let you have one of the reports and the recommendations about COVID-19.
Okay, share one or two with us. If
I can
yeah, share one
show
or two
you.
with us.
You can
So-
have a copy.
Yeah, okay. That's nice. We'll have to. Okay, so pressing information needs in the rural community on COVID-19 in Ghana. What stakeholders must pay attention to? That is Margaret Kweku. Okay, there are a lot of wow. I think it's voluminous. So you yourself will be touching on one or two that you want us to know. If there is any clarification, we'll quiz to be able to know. Viewers, I think it is the coronavirus that is the enemy Ghana is fighting. And you home, whatever party you belong to, whatever party anyone watching us belong to, you would appreciate this effort by the NDC to bring technocrats together to help the government in fighting COVID-19. I per se, I think this is something good. They can't sit aloof and just watch, and then later on they come and be demanding for us to vote for them. It is something that is worth emulating. The next time another party at all is in opposition, let's all bring our arsenals together. Let's help one another fight this enemy to Ghana. I think it's a very laudable step that you've taken. And then, so what you are having, let's share one or two things that you're able to do to augment the team to be able to help the government on COVID-19. So we can take one or two of them. If I'll be able to read. So in a wake of, let me read something small from Professor Margaret Kweku's write-up. In a wake of COVID-19 pandemic, which has also affected Ghana, government has put in place several measures in an attempt to control both vertical and local transmission. The President of the Republic has during his fourth update on the COVID-19 outbreak, highlighted the following as measures taken by government. So those are some of the measures that the government has put in place, and one of them is closure of all borders and mandatory quarantine of all travelers for testing. 2, promotion of social distancing protocol, and as you see, we are actually emulating that, we are practicing it. And so the third one here is promotion of good hygiene, and the fourth one is lockdown of affected cities for 2 weeks effective 30th March 2020. And then the last one that I have here is educational message on prevention activities on radio and television. So those are some of the recommendations of the some of the steps that the government took to stop the spread of COVID-19. Now I'll be asking him. Currently, we are my producers are letting me that we have about 161 confirmed cases. We also have an indication that we have about 31 of them being recovered. So that is a good thing, but the increase is what I don't like. The increase is what I don't like, but 31 recovering is a good thing that we're hearing, good news on that. So, Prof, share with us some of the other things that you yourself recommended here on this paper that I'm having. Let's share with our listeners and then viewers.
Okay, what I did was, with all these measures government has put in place, I was just thinking, how is the information getting down to our people, and how are they taking it? How do they understand it? So when I started my education, I started with the FM stations.
Okay.
But I realized that it is not everybody who listens to the FM stations. So what I did was to seek permission from chiefs and elders and assembly members, and then visit some communities where they have community public address system.
We are talking about Hokwe municipality.
Hokwe municipality. So with the community public address system, I can talk to them about coronavirus.
What are some of the things you've been telling them?
I normally talk to them about what causes it, how you can get it, and then how you can infect another person, what to do to prevent spreading the disease, and how to take care of your children and your family. All these things I tell them.
Okay.
So after talking to them using the public address system, the chiefs invite some of the community members, not more than 25, 30, to come around who have questions. So they come and ask questions, and I clarify issues. So some of the myths and the misconceptions they have, I took notice of them. And I thought these are some of the things we need to take note of and try to address them. Otherwise, when we continue talking about WHO guidelines, our people in the communities will be practicing something else.
Well, this is the hard truth, Prof, and you are here. So share with us some of the things you have been teaching them in the communities. Then we'll come and look at some of the questions they have been asking you, and then your answers to them. So what are some of the things you've been teaching them to do?
I normally talk to them about where the disease is normally located, where it can enter the body, like through the eyes, the nose, and the mouth.
Okay.
And the virus is normally concentrated over there. Therefore, if you sneeze or you cough into the air, you blow the virus out there. And anybody passing by will inhale it. So if you want to sneeze or cough, you either use tissue or toilet paper, that's zero, or if you don't have any of those, you can use a handkerchief to close your mouth or nose before you sneeze or cough.
Wow.
And we know that unconsciously we can easily put our fingers in our nose easily. Sometimes when we are counting money, we put our fingers in our mouth to take some saliva to be able to count money.
Typical of a Ghanaian.
Yes. And so if you have the virus, you can continue spreading it. Therefore, we need to wash our hands frequently with water and soap. And so I always tell them that we know that it's not everybody who has running water. And you can't go to a community pipe to say that's where you are going to wash your hands. So I've been encouraging them to all use the tippy tap, which is very common. This is a simple construction which is in various schools, where they use a small gallon, put in some water, hang it on a stick, and then two sticks, and then there is one down with a rope, and as you press, and the water Yes.
I saw some in my director's home, KLM. There is one, it's 2 sticks.
Yes.
There's a small gallon in the middle.
Yes.
You press it, the water starts coming.
So you generate running water.
Yeah.
Yes. So, and some who can afford, I encourage them to get Veronica buckets.
Oh, okay. Okay. What are some of the questions they've been asking? They have some misconceptions. What are some of the ones that you've been saying to your hearing?
Some of them, I can read them from here. The first one, which borders most of them,
yes,
is whether the local gene, akpeteshi, could be used to replace sanitizer for preventing COVID-19 transmission.
Wow.
As most of them drink and wash their hands with it for that purpose.
Already they've started using it.
That's what they are using.
And come to think of it, does that local drink advertising, does it help in preventing COVID-19?
Yes, the idea is because on TV and radio, they are told that use sanitizer, which contains alcohol from 60 or 70% upwards.
Okay.
So they felt that if we cannot get sanitizer with alcohol 60 or 70%, then the best thing is that the local gin akpeteshi is also alcohol. So we can wash our hands with it and it will kill the germ. And since the virus is mostly in the mouth and the nose, if they drink it, it will also kill the virus in the mouth.
Wow. And as a prof on their field, is it advisable? Their misconceptions, does it carry any iota of truth at all?
Well, that's what they believe in. But I try to discourage them that you cannot continue drinking akpeteshi every day because the disease is not coming for one day and going back.
Okay.
You can't say that you drink akpeteshi one day and then it is gone. And how often can you wash? Akpeteshi is not just water somewhere you go and fetch without paying for it.
Yes, you have to buy.
And so you have to buy.
All right, Prof, let's look at this. The akpeteshi, is it up to the 99% alcohol we are talking about?
No. So I tell them that the akpeteshi that we have is 40%.
Okay.
While the sanitizer contains 70% alcohol.
So therefore, if
the
we
difference
use akpeteshi to wash or sanitize our hand, it doesn't kill the germs, it doesn't prevent it at all.
It can, well, we need to research into it to find out whether it does.
Okay. For now, there's no research.
But for now, there is no research that has confirmed it.
Okay.
But then we cannot encourage everybody because akpeteshi too is expensive. One thought is 1 CD. Now I learned because of that, it has become 2 CDs.
Wow.
If you have to wash your hands 15, 20 times a day.
You have to buy 50 CD or 30 CD or what?
We don't have to encourage that.
Really, on that note, I think I have to go on a very quick commercial break and then I'll be back. But before then, I think my phone is on the ground, and since I've picked my phone from the ground, there is need for me to still sanitize my hand, and so that I won't have any. I don't think I'm going to use akpeteshi. I think KLM is used to akpeteshi, so I don't know whether he will use akpeteshi. KLM, will you use alcohol in sanitizing your hand? He's doing his face and wavy. Okay, viewers, quickly, let me go for a short commercial break. I'll be back. I still have Prof in the house. We'll continue with the show. Stay tuned. Welcome back. The Hard Truths on Star TV. It's your most cherished weekend current affair program. We bring in the most qualified personnel and technocrats to teach us about the topic of relevance that we need to learn one or two from. In the house, we have Professor Margaret Kweku. She has been teaching us a lot on the COVID-19, and I still have her in the house. Prof, we are back from the break, and you were sharing with us some of the misconceptions that you encountered whilst you were on the field teaching, trying to educate your people in the constituency. Share one or two more with us, and let's see what some people are thinking, and let's see what recommendations you have for them.
Well, another one is that they wanted to know if a family has 5 to 6 people you sharing one room, what should they do?
Okay.
And then they are also worried about food vendors,
Okay.
sachet water sellers, and bar attendants.
Okay.
What they can do to prevent the spread of the disease.
Okay, like 5 or 6 people in a room.
In a room.
Whether that can affect them.
Yes.
Then food vendors.
Yes.
Whether they can also transmit it in a way.
Yeah.
Okay, what answer did you give to them?
Well, with the family size of 5, government cannot go putting up buildings to space people. So the advice was that even if there are 5 sharing a chamber and hall, they should make sure there is spacing, and they make sure that they open the windows so that there is good ventilation in the room. But in case they notice that one person is coughing, sneezing, or having some signs and symptoms of flu, they should quickly call the helpline.
Quickly on that, Rob, already we've been having these symptoms with us before COVID-19 came about. So how are we going to be sure or certain that if I'm coughing and it means that I have COVID-19 or something of that sort?
It was one of their questions. That how do we differentiate between COVID-19 cough and then the normal cough? The cough has been with us for years.
Yes.
So I tried to explain to them that COVID-19 also presents like flu, the usual flu. But now that we don't know which one is which, anybody who has a flu should report. It is through testing that we will be able to tell whether you have COVID-19 infection or not. If you are tested negative, then you are free. But if we allow people to continue coughing, sneezing all over the place, we will continue spreading the disease.
Didn't they talk about stigmatization?
No. This one, what is disgraceful about it? This is something you can get through inhaling. It's not that your sexual behavior has caused it or anything. So anybody who is coughing, sneezing can spread it. Yes, it's a reflex action.
Probably myself, I've gone through maybe the testing, and then I was quarantined for maybe 14 days. Then I came back and say, hey, he had the COVID-19 already.
Anybody at all can get it. As for this virus, it has no respect for president, minister, chief executive, a rich man or a poor man. Anybody at all can get it. So we don't classify that these are the group of people who can get it. So therefore we must all be concerned. As I'm here now, if I come into contact with the virus, I can get it. Does it mean I have misbehaved? No.
Okay, the other misconceptions about food vendors, and what actually were they saying, and what did you tell them?
You see, their worry is that food vendors who are selling food, some of them mentioned that, like, if you go in for akweteshi, they are using one glass to serve everybody.
Yeah, that's true.
Can they get infected? So that one, I started advising them in the community that if you are an akweteshi seller, you should make sure that you have a lot of glasses, and then you wash them immediately after use. You don't just put it there and continue serving people. And food vendors, what their concern was about fufu. That they use the fingers to, so won't they infect the fufu before they eat, and that is where the frequent hand washing comes in.
Okay.
So they have to ensure that they are washing their hands frequently.
That's deep. Prof, you also have here, they were asking what to do when their relatives come visiting them with no room available for self-isolation or quarantine.
Yes. So when they ask that question, I explain to them that the best thing they should do is that it's your relative, it's your daughter, it's your husband. But so far as the person is coming from somewhere, don't go continue hugging and doing all sort of things.
Okay.
Yes. But what we need to know is that when the person arrives, you don't just allow the person to join the family of 5 who are already overcrowded, and then life continues.
Okay.
The person should be isolated for a while.
Okay. Okay. That's deep, because in the case of Hohoi, when the president announced a partial lockdown in some of the regions like Accra, Tema, Kumasi, we saw that most of them were coming to Hohoi, and that was a worry. And was that something that you would have recommended was done? Because looking at the influx, maybe someone will be having it over there and then you transport him or herself to this place and they'll come and spread it here. As at now, it was rumored we have about 15 cases, but they all tested negative, so we don't have any case here in Volta region and in Hohoi. Looking at the influx, won't it affect us?
It can affect us. It's a worry, because if there is a lockdown in Accra or Kumasi, it doesn't mean the people should move out of Accra. They should have remained there, but it looks like the message wasn't clear
to them.
So they started rushing.
They thought it was something scary.
Yeah, so they started rushing. So if some of them have the infection, we will not feel it today. Today is day 2 of the lockdown.
Yeah.
It will take about 2 weeks for us to start seeing signs. So what I did was to send a message run through the radio station that whoever comes from outside, especially from Accra and Kumasi, when they visit you as relatives, please let them be isolated for at least 2 weeks. They will be with you. So if you have a room, let them stay there. You feed them. We are not saying reject them, but accept them, put them there, feed them, and let's see what will happen.
All right, Prof. Building on that, some of the questions they asked or the misconceptions they were having was related to what I just asked. Let me read directly from what you have here. It said, how an individual living alone can ensure hand washing and the running water in the absence of pipes and taps.
Yes. What I encourage them to do is that if you are in a compound house, you should have a tippy tap over there or a Veronica bucket for the whole compound. We are not saying each individual should have one tippy tap or a Veronica bucket.
You can be in the house for a lot of people.
So if you are alone in your room, you can go and use the tippy tap or use the Veronica bucket to wash your hands.
All right.
But don't say because you don't have a tap in your room, you cannot wash your hands. And you know, in Hopewell here, nobody lives in isolation. You are either in a compound house, but you are alone in your room.
Yeah. Okay, let me look at one more, then we'll look at the recommendations that you gave. He said, what measures can be put in place to protect their crawling kids or children against the disease? Okay, viewers, so what we are actually looking at is that Prof has been on the ground teaching the people in the Hohoi municipality how to stop the spread of COVID-19. And so we are asking some of the questions, the misconceptions that the people pose to her. Probably you and I will be able to get some answers from there. So the last one that I'll ask before I go to some of the recommendations is that they said they want measures that can be put in place to protect their crawling children. And then add the fact that when nurses come to work and probably attend to maybe affected or suspected patients, they go home with the same dress. I mean, the nursing dress. Won't that also affect? So tackle the two for us quickly, and then let's move to the recommendations.
Thank you. When they ask this question, you know, when you are in a village, your child is crawling. You leave her there, you go to the kitchen cooking, or you go to bath, or you go to market to buy something, and the child is there. Anybody who comes from town, be it your friend, relative, come, hold the child, they start playing with them. So my advice to them is that this era of COVID-19, don't allow people coming from outside to come and play with your crawling child.
Wow. Okay. Prof, thank you very much. You've shared a lot of information with us. Now, my viewers are watching. I'm here. We all want to take clue from your recommendations. What are some of the things you recommended with just some 3-4 minutes? What are some of the things you recommended that must be done or should have been done?
What I recommended should be done is that we need to address these misconceptions and not just stick to the WHO guidelines.
Okay.
Otherwise, the effect will not be felt.
Okay.
So I encourage that anybody who wants to support government or wants to take up education at the community level, we need to address some of these issues raised by producing flyers or using the van public address system. If you go, you don't wait for the people to ask questions, because you don't have to gather the people around. You can distribute the flyers, and the flyers must have demonstrations.
Okay.
Yes, so that people can take them home and read. And also the van, they should take time to explain some of these things. Apart from mentioning the WHO guidelines, they should let the people know that no, Akweteshi cannot do the magic like sanitizer. You should rather wash your hands frequently with water.
The mention of Akweteshi is disturbing Dr. Duncan, one of my producers.
So is it agogro they call it? Or what?
The same Akweteshi.
Is this? Oh, there is another name, Umoji.
Apevia.
Dekele. Okay.
Okay, so share 2 or more recommendations with us, and then let's move forward.
Yeah. So another recommendation I asked that they should do is that we should find alternative measures for communicating to the indigenes how to achieve safety practices. For instance, in the overcrowded families, how to ensure safety in the household. These are the messages we should put across.
Okay.
Because government cannot put up structures for everybody at this time. So we should change our attitude. And then parents should wear nose masks when they experience any flu-like symptoms before getting close to their children. And they should also call the helpline. And then I encourage every household to have a tipita, which is very, very cost effective.
All right. Thank you very much, Professor Margaret Kweku. So we've been having interaction with Professor Margaret Kweku, who is the PC for NDC, but has decided to lay that one aside and help us understand the nitty-gritties about the COVID-19, what is happening, what we must do to stop the spread of COVID-19. We are privileged to have her here on the Hard Truths on Star TV. I'm going to give Prof some few minutes to address the public, basically what message he has for Ghanaians he should address us. Prof, speak to Ghanaians what exactly you want them, you want to carry forward to them. They are listening to you or watching you.
Thank you very much. Fellow Ghanaians, my brothers and sisters, I think this disease, COVID-19, is not for any political party. The disease can affect anybody. Let us join hands to combat this disease. The only way we can combat this disease is for us to change our attitude towards the way we do things. There is no drug or vaccine for the disease now. If there should be a drug or vaccine in future, I think it may take a year or two for us to get it. And therefore, we don't have to wait for the drug or the vaccine, but we need to take care of ourselves. We have to come up and make sure everybody complies. Whatever we are asked to do, let us do it in good faith. It is for our own good. If you don't trade for 2 weeks or 3 weeks, I think it's better than you losing your life or losing a family member's life. So, my friends, brothers and sisters, let us come together as one people of Ghana and fight this disease.
Thank you very much, Professor Margaret Kweku. In a COVID-19 way of greetings, I say we are very grateful you came on this show to educate us on what we should do during this hard time. COVID-19 is an enemy to Ghana, and all of us must come together to be able to fight it. A very big thanks to my producers, my crew, KLM handling the camera, Dr. Duncan, Victor Parker, Benedicta, Sir Edem Mackenzie, and Lady Bless Atika. My name is Atik Baga Eric Salikem. Till next week, shall meet again.